Let's talk about what your healthcare should look like. If you're 30 or younger, you should be going for annual physicals. You'll be talking to your doctor about lifestyle, disease prevention, vaccines, sexual health. If you have a cervix, you will also want to be getting pap smears. When you're between the ages of 30 and 40, you're still going for annual physicals. You'll start talking to your doctor about common diseases that might not cause symptoms at first, but if you detect them early, it'll save you lots of pain and money later. These are things like obesity, hypertension, heart disease, and diabetes. And when you're older than 50, you're still going for annual physicals. They never stop, but you'll start having cancer screenings. These can include things like mammograms or colonoscopies. But for you, as a teen transitioning out of the foster system, you need to pencil in these medical appointments. You want to see your family doctor for an annual checkup and flu shot. This is the most important one, because they will help you coordinate all the rest of your appointments. If you have a child, you should be taking your kid to the pediatrician for an annual checkup for them. If you're a woman or you have a uterus, you should be seeing a gynecologist, and you'll be going for an annual checkup and a pap smear to check for cervical cancer. If you have any concerns about your skin, acne, or just a weird patch or something, you can go to a dermatologist to have that checked out. You should see a dentist 1 or 2 times a year. And if you have concerns with your eyes or need glasses, you should see an eye doctor every few years or as needed to update your prescriptions. But again, family doctors are the most important one, and they can help you coordinate all the rest.
But what should you bring to your healthcare appointments? The most important thing to bring with you is your health insurance card and a valid form of ID. Other important and helpful things to bring are a payment method, a list of allergies and family medical history if you know it, a list of all current and past medications. Additionally, my biggest tip for medications is perhaps right now you might not have any medications or you might just have 1 or 2. But if you start to have many medications that you're on, it can be hard to keep track of everything. So you can either bring the medicines directly with you in a Ziploc bag to the office, or whenever you pick up your medications from the pharmacy, you can take a picture of the paper bag that it comes in because it has the names and amounts on that paper bag. Paper copies of all relevant visit summaries, test results, and doctor notes are also important if you have a medically complex disease and you want to make sure your doctor has all the information. If you have a lot of symptoms or you have a chronic problem, then writing down the symptoms, for example, if they happen in the morning or after eating, that can be also really helpful. And then a notebook. Notebooks can be really great to note down information that the doctor tells you. Perhaps he tells you to exercise more or to take some medication at specific times of day. You can write all of these down so that later on you don't forget. However, if you feel like the doctor is giving you a lot of information, you can also ask them to write down the information in the notebook for you. Or you can use your notes app on your phone to write down all of the information I talked about, so that if you ever have to go to the doctors in an emergency, you won't have to worry about forgetting your notebook or your list of medications, because it's already all on your phone. My last tip is to schedule your appointments in the fall. That way you can get your yearly physical and also the flu shot at the same time.